Okay, good afternoon, ladies and gentlemen. This is very different setup here. Today it's odd for me also because always we have the officials sitting there and the MPs sitting here. But since it's a round table, I thought it was better that we all sit around the table. First of all, let me warmly welcome all of you all. This is a result of a request made by WFD to organize a roundtable on inclusive budgeting with members of parliament, or rather our committee, and various civil society organizations. I don't know whether when you chaired, Honorable Sumandina, whether you had anything like this, whether we had or otherwise. I think this is a good start, but I think we need to do this long before the appropriation bill really gets written out, because right now it is already the job is done, and today we will take a vote on the budget, the first one, and the committee stage will start, and we will debate for another, I guess, 3 weeks, and when we'll have a final vote on the honorable members on this side, please. Today it's a different setup. We'll take a vote on the entire budget. Before we start, I just want to appreciate the work done by the Institute of Policy Studies. We have just got the report on the assessment of government policy priorities. Dr. Veera Singh and Dr. Arunatilaka and the staff, this committee appreciates the help, the professional input. Actually, the entire report now for the last few years had been outsourced to the IPS. Hopefully next year, when we have the fully fledged parliamentary budget office, you could act as advisors and not necessarily actually undertake to do this work. The objective is that, but nevertheless, we thank you. And this, as always, will go as an IPS document. It will be an IPS document presented to the Committee on Public Finance, and we will submit it. So it will be archived and will be archived in that manner. So without further ado, let us get started. What I'll do is I will ask you to introduce yourselves for the record. This is videotaped, or rather whatever it is called, that's called videotape or whatever it is. It's recorded. So this will be available to the public in a day or so. So even though this discussion is here, it's not limited to this group. We will release it to through the Parliament website. We will release it to the press and others. A lot of people download our YouTube videos, and you all can also, whatever, whether you want to reshare the whole thing, or there are sections of which you would like to highlight, you're welcome to do that. So shall we start from here, and then we can go down the table.
Lasantika Hetya, Manager at Transparency International Sri Lanka.
Sankita Gunratna, Deputy Executive Director at Transparency International Sri Lanka.
The Gender Equality and Social Inclusion Specialist for the National Democratic Institute, Sri Lanka.
Sanjay Vikraraja, Country Director for Westminster Foundation for Democracy.
Gayatri Lokuge, Senior Researcher, Center for Poverty Analysis.
Dushni Verkon, Executive Director, Institute of Policy Studies of Sri Lanka.
Mohammed Ziad, I am representing as a member of EWG.
Nisha Arunatilaka, Director of Research at the Institute of Policy Studies. I'm Shihara Madhwage, Program Officer, Westminster Foundation for Democracy.
Marian Fernando from National Democratic Institute, a Senior Program Officer for Gender and Social Inclusion.
Chamani Prematilaka, I am the Program Manager for Parliamentary Development at National Democratic Institute.
Vagisha Gunasekara, Country Economist, UNDP, Sri Lanka.
Malinda Migota from Verite Research.
Sepali Kottigoda, Program Director, Women's Economic Rights, Women and Media Collective.
Taranga De Silva, Director Operations, Women and Media Collective.
Asuko Pesekara, Country Director, National Democratic Institute.
Shanali Pereira, Project Lead, #Generation.
Khyati Vikramanayaka, Center for Policy Alternatives. Dilakshini Angunavla, representing the International Republican Institute.
So a wide collection of civil society organizations, much more than I had expected. So this is a wonderful opportunity for us to sort of talk about issues that perhaps you would like us to highlight, perhaps things that we have missed out, perhaps things we need to worry about more. And also let us introduce, sorry I forgot. That's okay, let it.
Yeah. Roshan Pereira, consultant for the CoPF.
Yasvi Karunaratne, consultant for CoPF.
So we have 1 hour 45 minutes left. So let us get started. I don't have an agenda. You haven't provided us with an agenda. Let us first figure out how we want to do this and then stick to a schedule.
Chairman, they have I think, yeah.
Right. All right. Then Mr. Vignaraja, would you start off here?
Thank you, sir. Thank you very much, Honorable Harsha De Silva. Thank you, Member of Parliament, for being here, and my colleagues from civil society organizations from very diverse group. Thank you for being here again, because this is a very busy month for you all, and giving us this 2 hours to have a conversation with you about areas that are very important for our work and for the betterment of what is happening in this country for the last, for this month as well. Especially for Westminster Foundation for Democracy, we've been a Parliament partner since 2015. But since last year, we have taken a little bit of shift in terms of looking at the economic inclusion perspective and working with civil society and different other diverse groups to see how we can bring the evidence-based approach to the parliamentary assistance that we are providing. And on that nature only, we have started this work as well. So we have partners who are part of the working group that we created as well here. Also, additionally, the international development partners as well as the civil society from different other groups also being represented here. I won't take much time. I'll give it to TISL to start the conversation on an overall objective of why we are here from the recent findings from their research, and then we'll also give it to NDI to talk about areas that they have worked on, and also SEPA on the research that they did with WFT, and we'll open up for discussion with everyone after that.
Yeah, so what we have here is like 7 minutes per presentation, and we have about an hour for discussions, right? Thank you.
Thank you very much. I speak here today about the civil society governance diagnostic conducted with the leadership of TISL, but with a core group comprising the Center for Policy Alternatives, Verite Research, Sarvodaya, PAFREL, and the National Peace Council. Now, the civil society governance diagnostic was conducted in the context and in the aftermath of the economic crisis that Sri Lanka was experiencing, but also acknowledging very much that it was a governance crisis that took place, that has led Sri Lanka down this path. So it is in that context, and in the context that the IMF was conducting its own governance diagnostic, that civil society thought it would be useful to get together to inform the process through a consultative consultation, island-wide consultation, that would give shape and form to the demands of the people in terms of governance reform for the country. So this report is the product or the result of island-wide consultations with civil society, with people, and with experts in relation to corruption. So it has a specific focus on the issue of corruption, not just governance in general as well. So what we've sought to do today is to set side by side the recommendations related to budget transparency and corruption, the core ones, and to set them side by side, but also to set out where the budget speech has actually addressed these things or not addressed them. So going straight into it, because there's not much time, this is the color coding that we're using, the civil society governance diagnostic recommendations in black, the IMF's ones in yellow, and the budget proposals in red. So we have clubbed this under 5 main categories. The first one is on tax reform, the second on procurement, the third on financial systems regulations, the fourth on management of state-owned enterprises, and the fifth on asset declarations, as well as the issue of asset recovery. Getting right into the recommendations, you will have this civil society governance diagnostic in front of you, and the numbers, the recommendation numbers are mentioned here. So as I go along, please feel free to refer to the relevant recommendations in the report before you.
This one?
Yes.
We have distributed.
We have more copies over here.
Yeah. You can give it to that. You can give it to him.
I will mainly focus on civil society's recommendations, starting off with the need to maintain a transparent platform for information on tax exemptions. Now, we are all quite aware that we are in a crisis of tax collection and revenue collection, revenue generation for the government, and tax exemptions remains a space within which a lot of leakage of potential public funding takes place. This is why we have asked for a transparent platform that sets out who tax exemptions are given to, under what criteria they are granted. And secondly, for the lack of time, I will move right along, about reducing tax exemptions over time. Because the continuous granting of tax exemptions. The third recommendation on tax reform that we want to talk about is publishing a quarterly revenue report highlighting measures with potential annual revenue loss of 0.1% of GDP. So we've tried to make the recommendation as specific as possible. So,
Sankita, what page are you on? What page are you on?
Recommendation number 3.
Which page? Summary of recommendations, page 46.
Or you can go to page 13, which has the recommendation in detail.
Ah, right, okay. Right.
That's the third recommendation, so that this acknowledges that transparency measures alone are not enough in relation to tax exemptions, but that there should be targets of reducing and curbing tax exemptions granted. On tax reform, this sets out the recommendations that the IMF has made on its own governance diagnostic. Now, we know that the IMF's governance diagnostic came out on the 30th of September after the civil society governance diagnostic, which was done to inform both government and the IMF in their negotiations in agreeing on what to prioritize on governance. What's important to note is that these recommendations, not all of these recommendations, still form a part of the governance benchmarks or the structural benchmarks that the IMF has set for Sri Lanka. So there is space for these recommendations to still be discussed and incorporated into the IMF's program with Sri Lanka, as well as to ensure that the necessary resource allocation is done through the budget. But I acknowledge that this is coming in a little late in the process, but it still remains important to make this comparison. The presentation is not showing.
Yeah. Well,
okay.
We can see on the screen.
Great. So these are the recommendations that the IMF has made on tax reform, and the budget proposals, the budget speech doesn't talk about a comprehensive tax administration reform, but it talks about the need to address corruption weaknesses in revenue collection authorities. We are conscious that the IMF's report also deals with this issue. Moving on to the second basket of procurement, public procurement, the Civil Society Governance Diagnostic Report has two main recommendations, recommendation 12 and 24. The first one talks about the need to, or recommends the need to publish online information about procurement contracts of over 100 million rupees with connected suppliers. And recommendation 24 talks about conducting an audit of the 10 ministries that have the least number of competitive bidding. As we know, competitive bidding leads to better pricing, better quality of goods, works, and services for the state, reduces the harm caused to victims or potential citizens, potential harm to citizens, but it also ensures that you reduce the leakage of public resources. So where competitive bidding does not take place, you will see unsolicited bids being awarded. You will see non-competitive or sole source bids being awarded at exorbitant prices to the state. So this recommendation is made in that context. The IMF governance diagnostic recommendations are also here. Talks about making procurement information public, but also speaks about the need for a public procurement law. For the moment, what we are governed by is the 2006 procurement guidelines. There was comprehensive consultation and revision done in 2018, but those procurement guidelines were never passed. So the IMF has actually recommended that a law be passed. We know that the procurement guidelines are given the force of law by the courts of law. However, it still remains complicated, complex to administer. There needs to be a law that is comprehensive, simplified, and is in one place.
I have to play the speaker's role and ask you to sort of wind up fairly quickly.
Thank you. The budget speech talks about the need for improvement in the procurement process and talks about legislation that is underway. Under the third category, that is financial systems regulations, it talks about the discretionary spending budget in the budget, and CoPF has also in the past talked about how this remains unaccounted for, that it is used as a discretionary fund. So limiting that to 3% of total expenditure is recommended in the civil society report. And then, because this talks about public assets, we have made a recommendation about alienating land for user-owned housing in the Malayaha Tamil areas, and providing minimum wage for plantation sector workers, which has also been addressed in the budget speech. Then recommendation 11 talks about quarterly publication of a complete set of updated information on public debt, because this information is not accessible to the public and very little accountability exists in this area. And the IMF diagnostic recommendations and the budget proposals, the IMF recommendation talks about it, the budget proposals does not talk about publication of debt information. On the same category, the Civil Society Governance Diagnostic recommends implementing all the provisions of the Fiscal Management Responsibility Act and for non-compliance to be penalized. The IMF diagnostic talks about revising banking oversight, and the budget speech talks about banking reform, but only in the context of increasing capital of the banking sector and improving banking regulation. And along the same lines, the seventh recommendation talks about minimizing corruption and waste in benefits given to political leaders and senior bureaucrats by enforcing transparent and accountable systems. And the IMF's and the budget proposals, dealing with it or not dealing with it is addressed here. Management of state-owned enterprises, the civil society recommendations talks about transparent and accountable management of state enterprises. The IMF governance diagnostic also focuses on this. The budget speech only proposes addressing SOE debt and need restructuring SOEs, but not so much on accountability of state-owned enterprises. On asset declarations and asset recovery, because it has a connection to the leakage of public funds and corresponding illicit enrichment and illicit financial flows outside of Sri Lanka, and because TISL has been advocating for better transparency and better regulation in regard to these areas, we thought we would deal with it. As you know, the new Anti-Corruption Act calls for publication of asset declarations of several categories of persons. So having a system for that is important, an online system, but there has not been an allocation made for that through this budget, while the IMF recommendations requires that asset declarations of key public officials be done by the end of March next year. On asset recovery as well, there is supposed to be a new law that is passed. I know this has been part of the public debate for quite some time now, but there has been no access to civil society at this point in that lawmaking process. We are told that a committee has been formulated to create a law on asset recovery, a Proceeds of Crime Act. We were part of, civil society was part of an earlier draft back in 2018, but civil society has not been consulted since. Given that this was a call of the people, I think that participation remains key. I will stop here, referring to some of the proposals in the budget speech, but overall, in terms of concluding thoughts, in terms of governance in Sri Lanka, there is a crisis. We saw the recent Supreme Court determination talked about maladministration as well. So even in this context, it's really, really important that in the issue of fiscal management, as in other governance decisions, that there is accountability, transparency, and public access to information so that there can be preventative action taken, citizens and civil society can act as watchdogs, and it will also serve as a bulwark and a defense to those public officials and those public representatives who act in accordance with the law and act in the best interest of the public. I'll stop there. Thank you.
Thank you, Ms. Gunaratna. Next one is okay. So then the next one will be by Ms. Shyama Salgado, addressing, well, from NDI. Yes.
Thank you very much.
So you take about 7 minutes, so you stop at around 2:40.
I can finish it like this. Okay. Basically, though I'm representing NDI,
somebody can fix the computer while she's working.
About, talking about gender equality and social inclusion. It is not the only thing that NDI does. NDI works across governance issues. So we work with sectoral oversight committees, committees on other issues, law reform, and the works, right? Open parliament, of course, Mantha. Yeah. So having said that, thank you all for listening in. What I'm going to really dwell on is 2 or 3 key areas that concern even the Women's Parliamentary Caucus and the Sectoral Oversight Committee for Women and Gender, whom we work closely with. One of them is really the importance of setting up a mechanism in either the COP or in the forthcoming PBO to monitor the gender aspects and inclusion aspects of the budget. What happens is usually the budget monitoring gets, the GESI part of the budget gets subsumed into the overall monitoring. So you have SMEs being given support or health sector support or transport support, but we are not zooming in on the specific aspects for women and persons with disabilities and other vulnerable groups. So the plea today is to have a mechanism that gets a little separate but also mainstreamed, if you know what I mean. You take affirmative action, but ensure you think about it properly when you're monitoring the budget and tracking expenditure. So, and that should be around the budget cycle, so from the planning stage to right down to the implementation and monitoring stage. And that's what you spoke about, so the horse has bolted a bit, but we can still work towards the next budget, and we have a lot of space in between. Having said that, two key examples I would like to give about period poverty. There was a policy in 2021, if you remember. During the budget debate, it was debated quite seriously, but nothing really came of it in funding allocation. Then again, in 2022 September, His Excellency made a statement and supported and told the Ministry of Women that they have to work with health sector. And somehow it fell between two stools, and we don't see it even in this budget under the health sector. The most they talk about is pharmaceuticals and other consumables, right? So we don't know whether these so-called consumables are really part of that budget. And there's quite a bit of budget in the health sector this time. And we don't see any allocation very specifically. So if you're going to have a gender-responsive mechanism, you also have to have a gender-responsive budget that determines which is supposed to be focused attention on inclusion and gender. So, of course, it's salutary that on page 166, I think, paragraph 43 of the budget speech, there is a reference to gender-responsive budgeting, gender equality, and women's empowerment. So we can find that as a hook to move forward, at least. And period poverty demands are just about rupees 7.8 billion, that is 1.3 million children getting approximately goods for 500 rupees per child, which is equal to 650 million rupees into 12 months till the next budget. So if you can slip it in some way, somehow it will be good, right? I can give you the figures, I can give you the note.
You know, what I want to say is, you see, the ministry budgets haven't been, I mean, they're not finalized. There is committee stage. There is always room, if government is interested, to push something through. So it is worthwhile even at this point, you know, if there are specific things that you can attach a number to, you know, that we can take up at committee stage and try to see whether we can push it through, just for all of us here.
That sort of thing.
Correct.
No. Yeah.
Well, it is for those in school at the moment.
Exactly. That's right. Yeah.
For the school-going children.
Yeah. Fair.
But we are giving it to everybody because it's very difficult and embarrassing and insensitive to say, okay, you need it free and you don't need it free. You see, so
Right. We are at least to start somewhere, maybe in school you can.
Yeah, you can do it incrementally, or you can phase it out incrementally later on, but we don't know enough, and we haven't monitored at all, I think. So I think that is something that we need to take cognizance of. The second point I want to bring up, do I have time? Yeah. And there is a leaflet here, which I can share with you all in two languages. I'm sorry, the Tamil version is still pending. Mainstreaming issues and concerns of persons with disabilities. Now, that is also very important. We haven't still got the bill sorted out, so that's a priority, right? One. Second one, we have to respond to the CRPD ratification, which we have done. So all these things also will play out, and when we have to report, it is very important. But that is not the reason we are doing it. It is a human right. And I noticed that your transport budget, I think there is a huge allocation there. It says in total 430 billion rupees, of which 98 billion rupees is for buses and railways. And they talk of safe transport. Now, what is safe? Safe for a person with disability is safety in getting on and off the bus and not being abused, and for women too. Right. Having said that, the allocation for new buses is estimated at 3,200 million rupees under capital expenditure at page 115 of the estimates. So that may be something we can reflect upon. And thirdly, the assisted schools, salutary that they have put in quite a bit of money for assisted schools, which also take in the children with disabilities. However, if the access to those assisted schools are not provided, like the ramps, the bigger toilets, bigger access to toilets and all that, they cannot really realize the full benefit of all this support. So that is something that we have to look at. And I noticed the special needs children's budget line remains the same, if at all a slight increase, and that may be because of the teachers' increments, annual increments or something. So it's just not enough even for true special needs education. So those are the two main things I want to talk about because of time. But for doing all this and what we want to do in the future, monitoring and more monitoring is super important. And you might be able to link with the DPMM of the executive also to see what has happened and create a structure within the legislature somehow to move forward. So that is what NDI's take is on gender responsive and inclusive budgeting to push forward, because we have to put our money where our mouth is.
When we found the budget office, this can be part of it.
Yeah. So thank you very much, Ms. Agadu. It is very informative, and there are lots of things that I personally want to pick up during the question session.
Chairman, just 1 second.
Yeah.
Can I also request, Madam, if you can, because I think the budget on education is on the 5th, if I'm not mistaken, if I remember right. 5th, okay. So if you can send us a little note, maybe some of us can speak on it, on those.
Okay, so sorry, Honorable Madam.
The budget debate on education, on education is on the 5th, if I'm not mistaken. If you send us a note on some of these things, we can.
A note, okay, sure.
Thank you.
Who would go next? That is on the
Transport and health.
Correct. Analysis of health and transport budgeting. Yeah, presentation by Ms. Gayatri Lokuge.
Yeah, thank you. Thank you for the opportunity. So as Sanjay mentioned very briefly, what I am presenting today draws directly from the work we have been doing with the Economic Inclusion Working Group that has been facilitated by WFD. So I represent Center for Poverty Analysis, and we do work on other sectors as well. But I'm today focusing only on these two specific sectors, the health sector and the transport sector. So in terms of the health sector, one of the things we've picked up as a gap is, something that we would like to recommend is allocations, stronger regulations, and monitoring mechanisms for elderly care services. Now, this is something really specific. I understand that, I recognize that. But I think all of us know that our population, the demographics are changing, but in about another 15 years, 1 in every 4 people in Sri Lanka would be actually above the age of 60. Do we have the services, the institutions geared towards meeting this demand, especially in the current context, where the children and the middle class, there is a high rate of migration of young people out of the country. So we've done some work on this, and we feel that there is a huge gap in this, especially in terms of elderly care services. And then we move on to scaling up primary medical care units. This is at the pilot stage right now. And what we advocate for is to actually scale these up, especially in the rural and the upcountry areas where access connectivity still remains a critical issue. We did some work in the upcountry area, especially in the central province, and we still find evidence of an ambulance taking about 45 minutes to reach these communities, and even at that point, the community actually have to transport the patient, down a hill or something like that, because the road connectivity is so bad, the infrastructure is so bad. And then, increased allocations for strengthening mental health related services. Again, something that we don't, something that's increasingly being picked up as critical for the current society. But what we would like to again, recommend for is to strengthen these existing services available and to, broad base it. And then again, more allocations for prevention of NCDs, non-communicable diseases. There's enough research showing that this has become a very critical issue. And what we also find is that there is an unwillingness, especially from men, to get themselves screened for various reasons, including the fact that there is long waiting hours at the government health clinics and things like that. Again, better allocations, but also taking some of these needs and requirements into consideration when the services are made available. Finally, for health, allocations for upcountry community health policy. As far as we know, this is still in draft form. So again, something that can be, if it can be pushed for, then also allocating the resources for the implementation of this policy. Then moving on to transport, allocations to increase connectivity in the upcountry areas. We're quite happy to see that the concerns of the upcountry communities have been taken up quite strongly in the new budget, including increasing and strengthening rural transport. But this still remains a critical gap, so we would like to flag this here as well. And then allocations to understand this trade-off between cost and quality of public transport. We've had a few discussions, especially with the NTC, and there is great interest to maybe conduct a survey, a public opinion poll, to understand how much people are willing to pay for certain kinds of public transport services. Not to say that we need to increase the fares across the board, but to understand the different segments, the different requirements, and the different communities that take public transport, and then to understand how much they are willing to pay for the different kinds of services that are available to them. I mean, one of our analysis showed that there's been a spike, a sharp spike in people taking up reserved transport, so reservations, especially railway. So this also sort of indicates the segment, I think, that moved from private transport to public transport with the fuel price increases. And what we would like to advocate for here is this, better information, access to better information on this, willingness to pay versus the quality of transport available. I will stop here. Thanks.
Thank you very much. Okay, so we have, are there any more presentations to be made? Okay. So what we'll now do then is, what we have is brief questions and clarifications, and thereafter for us to share insights. So we can raise initial queries before we have a more sort of a detailed discussion.
Chairman, just on the health, I also happen to be the chairman of the Sectoral Oversight Committee for Health. One of the things that we are doing, in fact, I set up a subcommittee on it, is for a patient's bill of rights. A patient's bill of rights. While looking at the drug shortages and other stuff, there's another subcommittee, actually two subcommittees that I've set up. So tomorrow we are having the ministry budget, the health ministry budget allocations and the progress reports and stuff like that tomorrow. But maybe if we can meet at some point to look at what we can do with the health sector. We are, as a sectoral oversight committee right now, we are not hitting hard because there's a new minister, so we are taking it, not taking it easy, but we are giving him time to breathe till he settles into his job. But then we will take up some of those issues again that were, you know.
You see, something that you might want to think about is a new VAT on health sector. You know, how it is going to impact, and whether, you know, what we should do to try and rescue, quote unquote, at least some items in that new VAT list. Do we have a copy of that? For instance, all medical equipment will now be taxed at 18%, VAT at 18%. So whether your studies would be able to give us some indication as to how it will impact people at large. You know, if you have been studying, I mean, even IPS, you have a lot of work that happens on health economics. You know, how is this going to impact? I'm just a point that I wanted to raise. Because, you know, you can always argue there is not enough money allocated for health, right? That's sort of, we can always do that. But then always there is some sort of priority areas, you know, where we are going to spend. Now, whether, you know, you spoke about allocations for young girls and women, where is that money going to be sort of set aside? You know, would it get set aside in the education budget? Would it get set aside in the health budget? Would it get set aside in the women's affairs budget? Where will it get set aside? So, I mean, if we can at least before we leave today, you know, perhaps formulate 3 or maybe 5 strong arguments that we can fight for during the next 3 weeks of debate, right? Then I think the time that we would have spent here would be worth it. Right? So something that perhaps we could think about is on women's issues, particularly this young girls and women's matter with the health budget. Yeah. Now we talk about period poverty has been something we've been talking about a lot now. Now we have fought, and late Honorable Mangala Samaravira made some concessions and reduced the taxes, import duties. Now I don't exactly recall what it is, and whether with this new VAT amendment, whether those will go up again in price. Has anybody looked into that?
The 15%.
Huh? Why don't you say what you have to say? Oh, go ahead.
No, I have...
yeah, where is it?
It's in that list.
It's in the list? This one? Where? So,
it has the exemptions.
So is it exempted or not?
Under the last budget, there was a story, to exempt it, the 15% VAT, to be exempted. Now, if under the last budget, that I think had less money, under the last budget, there was this request to exempt the 15% VAT.
Yeah.
Right? Now, in the circumstances, I think we drafted a last budget under more difficult circumstances than we have drafted this budget. So if we can, yeah.
That's what we want to know.
Yeah.
Even last budget, so it was
15%. Yeah.
Never
happened. So can't we do it at least now?
So
that's my question, because we are better off now.
If we are the decision makers.
Okay.
And also artificial limbs and things like that. You're talking about disabilities. They are going to get VAT at 18%.
The consultants will only speak to the chair.
Huh? Yeah. No, we are looking at something. It's not there, right? So what it means is it's not in this list.
Not in the list. Not in the list.
Not in the list.
Right. That's what we want to know.
So
there is an exemption list too? Yeah. But this is not in the exemption list.
Last year, high-tech medical equipment was exempted, but this year it's
not.
No. We are not talking about high-tech
But
medical
it's not in the list. It's not in the list. It's not.
now this is a bit confusing. All what we want now, say in this list, there is an item called artificial limbs. Now, what does it mean? Does it mean that artificial limbs are going to be taxed at 18% or not?
It's exempted. It's exempted. That's exempted. That's exempted.
Exemption. So sanitary products are not exempted. So that means it will go up to 18%, which means the problem is going to get even worse.
So that's what we want to know. So at the committee stage, we can all say put it in the exemption list.
Yeah. So there is. Can I just sort of? So there is the list under the list. It says supply and import of pharmaceutical products. So it's very vague. Yeah, exactly. Drugs other than cosmetics, in use of which are confined to therapeutics, prophylactic effect, and purchased on prescription of physician, raw materials for the production or manufacture of such products or drugs. So when you say pharmaceutical, I don't know whether it comes under pharmaceutical. It's not a pharmaceutical. So basically, it won't be specifically.
By interpretation of this document, it says consumables also.
Yeah.
Pharmaceuticals and consumables.
Yeah.
Exemption.
No,
Exempted.
they talk about the allocation. So by then relation to that, if you're talking of pharmaceuticals, are we extending?
This is the exemption list.
They all exempted, but it doesn't specifically talk about.
Are you sure this is exemptions list? Where is the list that they sent us, the finance minister list?
This is exemption list, correct. Schedule B.
No, where is the list that they said that was going to be brought under VAT? Okay, until we find that. Please.
No, there is also this yesterday or day before there was some statistics about teenage pregnancies. Yeah. How many? 200,000?
No, 2,000.
2,000. 2,000.
2,000.
Anyway, whatever the numbers are, there have been a problem right through for the past decades.
Yeah.
And I think that's a violation of history.
Yes. Yeah.
Right, because statutory rape also is zero.
The exemption list actually.
So to address that issue, what is the in terms of budget allocations to address that issue, what do you think should be proposed? Sex education in schools, what are the other measures? No, we are talking about teenage pregnancies. So contraception.
There has to be education under the Ministry of Education, I recommend, and then under the health sector as well, we should be looking at safe contraception as well.
We've struggled with that syllabus
Saying
for so
contraceptives
long.
and distribute free contraceptives to schools also.
Along with the Ministry of Education, generally in other countries as well, there are programs that are done with safe education. Teen pregnancies happen in different parts of the country as well. To ensure it's safe, you also have to propose the education along with the same contraception, safe contraception. No, so talking about sex education is important in all these schools. It also, in terms of the Ministry of Justice,
comes in under 18 is statutory rape.
Under 16. Under 16. Under 16 is statutory. 16. Under 16.
16. 16.
Yeah.
So there is that window of 16 to 18, which comes consensually.
But 16 is the age for consensual sex, although it's technically underage. But I think even the contraception, this has come up several times. I know when I was in the NCW also, we had a discussion with the Ministry of Health and Education, the sex education for teenage school children, that's been prepared again and again and again, and it is not implemented. And yeah, it has to be for both boys and girls. So the allocation, there has to be a push for that, and the contraception has to be available. There has to be knowledge about how and when to use it, because you cannot. I mean, this is an age of this 21st century. Young people are not sitting around anymore. They are exploring a lot of. They have been exploring their sexuality for decades. So we have to get real that if we want to stop teenage pregnancies, we have to make the young people knowledgeable and confident as well. And in terms of the period poverty, I think one argument for reducing tax on sanitary towels, etc., is the girl children are dropping out of school. They don't go to school. They don't sit exams, because on top of that there aren't toilets that students can use. So it really is tied up in this way, which is discouraging young girls from going to school for X number of days of the year, and then also not having toilet facilities in public schools has been, I think everybody knows about that, and that has to be an allocation for that as well.
You see, I think somebody needs to quickly study the actual effective tax rate on sanitary products. Let's take it. We have some days we can really study this and see what the impact is going to be with the new taxes, right? Because there is another point that comes into play, and that is depending on where you're going to purchase this. For instance, the VAT threshold has been brought down from 80 million to 60 million, which means if you're buying from if you used to buy from a small kade, there would not have been VAT, right? So if you're now buying from a small kade and the transaction volume is less than or more than 60 million a year, then that means that person will be VATable. The social security levy was at 120 million per year, which is coming down to 60 million, which means those two taxes will also apply on products that you purchase if you purchase it from like a supermarket or a big kade, right? So where do people buy these from? I think maybe there is research available with people who look at trade research and see what the offtake is from and where. And if you can prove that there is more than the 3%, right? More than the 3%, yes, Honorable Hakim. Right? The 3%, actually it's not 3%, it's 20% increase of VAT, if you really look at it that way, right? 3 percentage points, right? Plus these other impacts, the cost of a packet of sanitary napkins will increase by a fairly significant amount. And perhaps you can look at it in terms of rupees and cents, and then perhaps argue that the total impact of this is such and such. I mean, I do not know this, but you just mentioned that there are so many number of school days missed because of this. This can be economically valued, and then you can come up with a dollar rupee figure. This is the cost of this tax, right? Like we talk about tax expenditure when we give tax relief. We give tax relief to various people, and then the government loses out, treasury loses out an X amount, right? But in this case, if you look at the impact of that tax on the population, and particularly girls and young women, then you can really make a case, because otherwise what will happen is we will talk about it, various people will raise it, and it will just die a natural death, unless we can sort of forcefully show that this is the impact. Perhaps, I don't know whether UNDP, IPS, Verite, all of you people working on women's issues can sort of jointly in the next few days prepare a specific fact-based document that anyone in Parliament who is interested in taking up this issue, then argue on those lines.
Proposal was to freely distribute them. Your proposal not to have the tax exemption, but to free distribution. Yeah. Right. Okay.
Right, and the
other
other
is
for
the
the
tax
tax
exemption.
exemption.
So both together.
Yes, and
So the
HEMAS
impact
is
of
doing
both.
some of it at the moment. HEMAS is doing something.
A suggestion by Dr. Roshan, I think is really valid here. And that is, instead of perhaps cutting the tax from 18 to 15, because not everybody needs this. But if there can be a cash transfer in some way, that people who require it, you suggested, is somebody suggested?
It's not a cash transfer.
No, the point is the government is going to be very sort of defensive about bringing down the VAT rate from 18 to 15 or 18 to 0, because it will go across the board. Not every woman needs a subsidy, right? We are looking at certain segments of society, right?
Schools, that's what.
Like for instance, we give the school uniform, no?
Yep.
We give the school uniform. So if you are giving the school uniform, we know how many girls receive the school uniform, right? So the voucher. So with the school uniform, if we can give a voucher, right, that voucher then can be used at any pharmacy or supermarket to purchase sanitary products, then that would only go to those who require. Perhaps that, city schools, rich folks may refuse to take it. That's fine. Right? We offer it, and if the need is there, they will take it. So that way there is no waste of money, because we are not giving it to everyone who requires it. And then we can start with schoolgirls now. Beyond that, we can worry about the next level. Is that something that has resonance? People do?
Yeah, I mean, might as well start somewhere. So I think it's.
So can we do that then? So one concrete result of this, can we work out that number?
Not the entire. 3 million is the entire school population of girls. That is the calculation
of what?
On giving approximately 520. I rounded it off to 500.
500 what?
500 rupees per month.
To who? How many people?
To one child, per child. I tell you. For the 1.3 million children who were identified in the previous discussions, each child will cost us 500 per child, we'll say, rough estimate, right?
Yeah.
That results in 650 million rupees.
Yeah.
Into 12 months, which ends up at 7.8 billion rupees.
Okay.
Yeah.
So 7.8 billion rupees, that's all it cost? For every girl child in school?
Not every girl child, that 40%, yes, the 1.3 of the 3 million, roughly. I mean, Age-wise, yeah.
So,
In school.
So what we are saying is every girl child who uses sanitary products, it will cost the government 7.8 billion rupees to give free sanitary products. That's what you're saying.
That's what I'm saying.
So, and if it is vouchers like what the chair suggests, actual cost will be even less.
Possibly.
Yeah, actual cost will be less because it is voluntary, no?
Voluntary, yeah.
It's a voluntary thing,
so it's a very small amount.
Reveal preference, no?
It's a very small amount.
I think this committee should make that proposal. So let's in the next few days we can actually work the numbers.
Okay, fine.
Who can take the leadership? Who's Nisha, can you all take the leadership? Or Vagisha, can you all take the leadership? Or Shama, can you all take the leadership? Or can Verite take leadership?
So we'll work together.
We can work together.
WFD and NDI can work together on that.
But some people already have the numbers.
Yeah.
Who's got the numbers?
Because we have some existing data that she...
No, what I'm saying is don't do that. What I'm saying is create a group. Because we have like a week, no? Not
sure.
even that much. Right? In a week, we can come up with a document.
That's what we are saying. We'll coordinate the group.
So you coordinate the group. I don't care who coordinates the group. All what I'm saying is people who's already worked on it and has numbers and has a sort of economists that work on these matters should come together. That's my point.
Okay.
We can get Roshan in because she's already with us, right?
Right. So after this meeting, you all can give us the game plan for that. So what's the next? If you're going to take 5 points, what's the next one?
Harsha, before you...
Yes, Dr. Arutilaka.
Chairman.
Yes, sir.
No, because this period poverty issue, added to that is, overall water and sanitation issue in schools. You see, unless you address that, you see, this won't be complete. You see, because but there was a project called WASH, Water and Sanitation Health project funded by the World Bank. You see, was it World Bank or somebody else? UNICEF also. So, the thing is, most of our schools, particularly mixed schools where this girl child gets into a lot of problems. So, we have to have proper, toilets, because this is a basic problem. So, that has to be addressed, and also sanitary laborers. Right? Without laborers, most of the schools, toilets are unusable. You see, so all these, it has to be addressed holistically. But this is a good idea. But then to add to that, those issues also have to be looked into.
Yeah, but honorable member, but that's a sort of a broad area, no?
No, already government is at it.
Yeah, what we are trying to do is to bring some specific proposals. But I do 100% agree with you. Right? Even at Royal College, I went to the toilet the other day. It was so bad. No. The Honorable Hakim's group apparently pays for the sanitary workers there. It doesn't have money. You think Royal College has money.
But I think the water and sanitation in public schools can be related to the Ministry of Education, the Ministry of Water, whatever it is, and construction, because that allocation has to come from there, not from anywhere else. And Education Ministry should also ensure that there are provisions, proper, adequate water and sanitation facilities in all public schools.
Yeah.
It's just unthinkable that that aspect is not addressed. We talk about free education and everything else, but there are no working toilets, and then there are no toilets that the girls who have their who are
I want to move.
to go to.
I want to move to the next one, which should be the next point. Is it health related or what? Transparency International. I'm sorry. Go ahead.
Sorry, this is outside what was discussed already. Relating to education, we're talking about inclusive education. During COVID times when you have online education, a lot of children didn't have access to education services. So there is a huge gap there is nothing allocated for remedial education in the budget, and I think it's a very dire need, because there was a study done at the Ministry of Education that a lot of children are behind. So something needs to be done, and also these exams being delayed partly because of this also. I think it's very important, and that affects all the school children.
I agree with you 100%, but what is the solution that we can propose?
They have already done a study. There must be some recommendations.
The study. The recommendation is even during the wartime, when children were displaced, there were remedial education given so that they can catch up with lost education, and they are again.
No, the remedial measures were identified in the study. Are there recommendations?
For the recommendations, not for the current situation, but earlier.
Yeah, I mean, this is the Committee on Public Finance. So we are not going to be able to sort of take policy decisions for the Ministry of Education. However, what we can sort of intervene in is propose sort of financial allocations for specific recommendations. Right? So if we can come up with a specific recommendation that costs so much money, then we can propose it. You see? So we have to come up with something.
Yeah, Education Ministry did a study to assess the loss. So I haven't costed it, but I think that is.
No, the point I was making was Education Ministry doing that study itself will cost. Somebody paying to some consultants
that's already covered.
Yeah, that's right. So, and if that doesn't, convert into something that is actually, used for remedial measures, that money is just down the drain.
Yeah, so I don't know, I don't know the answer, but I'll tell you something else, and perhaps Verite can help us with this, is if we are proposing a 5 billion increase in the education budget for these vouchers for girls, we should also show where we can take that 5 billion from, right? So where is it that we can cut 5 billion and then we can add 5 billion, right? I'm just taking a number because you all do a lot of sort of budget analysis. Perhaps you will be the best to show us where we can cut 5 billion, unless IPS also has, information on that, because you all did this report. So on Dr. Arunatilaka's matter, can we have some progress or not? Or?
It is difficult because we don't have all the details of exactly where the money is going. It's at a very broad level.
Even we don't, it doesn't matter. What I'm saying is, what is the specific intervention that we are proposing and how much will that cost? That's my point. See, I'll tell you my radical proposal is that we just cut off a grade.
Already we are unnecessarily one grade more. We O-levels after 11, when we all did it at 10.
We all give every kid a double promotion and then sort of recalibrate and, have some afternoon classes or whatever, and then come back to, just give every kid a double promotion. Do we need grade 8? Do we actually need grade 8? I don't know. Do you remember what we did in grade 8? No, I know.
I just have proposed that we focus on a particular, like maths language, and maybe do like the Khan Academy type thing. So I don't know, something like that we can propose. Like a videos that you can send to these schools.
No, the thing, Erosion, is that they don't have the facilities to even run these videos. No, they don't have data, they don't have computers. Yeah. Yeah. But then but then every proposal we give must have value, where
So,
we are going to get money from.
One place it can come from is there was a recommendation that laptops be given to all 1AB schools. Actually, that's going to increase the inequality because I think most of the 1AB schools already must be having computer facilities. So, I mean, that could be directed to actually the type 3 schools where they might need it more, not even laptops, some kind of remedial education which is accessible for them.
I have a big problem with this new VAT list because it is going to increase inequality because, computers are going to get, will be VATable at 18% from 0, right? So that's a big expense. So if a computer is going to cost like 500,000-600,000 rupees, perhaps even more, how can low-income kids, others afford it? So isn't there anything that we can pick up, gentlemen and ladies, from this education sector, from what you all presented?
Since we talked about child pregnancies as well, so for the month of September only, we have 168 girls who got sexually assaulted. All of them are below 16, and we have 22 pregnant already. So since we talked about this, is there any possibility for us to bring mental health services as well, along with while we are, just September we have 168 cases reported. And already 22 are pregnant, so
122 cases of
168 sexual assaults on young girls. Yeah, and 22 are pregnant already. Yeah. So while we are trying to debate over bring the conversation on poverty period, and can we bring the conversation on providing sexual education, sex education, along with mental health support system, a solid mental health support system? Is there any possibility for us to allocate some funds, create a proper system using that funds to support girls and boys as well?
I mean, the Mental Health Act of this country was written in not the previous century, the one before that, 19th century, if I'm not mistaken. Yeah, so in 19th century law, which is still applicable today, with online, all of this stuff, which is completely contradictory, The regulations are so old. So there is an urgent need to update the Mental Health Act for sure. And if once the Mental Health Act is updated to reflect the current reality, whether then your concerns could be better addressed is...
This is support services in schools, or even you may not be able to provide it to every school, but in certain localities at least, if there is someone to whom the girl can talk to, kind of thing, no?
So one of the things that's already happening is the public health midwives, the PHMs,
right.
they are actually now reaching out to the adolescent girls. So all this time that was sort of like a no-go area. But now we see that system, because that's one of the best systems on the ground.
I think that is where one must go to, because those work, the MOH kind of thing, where they have the clinics and pregnant mothers go regularly. All that works in this country quite well, right? So if they can extend that to this kind of situation, and particularly train one person who's trained to deal with this, that's...
I mean, you all are the experts, we are not. I mean, you need to suggest something to us, and then our job is then to see whether we can get money allocated to do these things. Correct, yeah. That's our job. You need to tell us. We are no experts. And we've been hearing about this lately, even in Parliament. There was a statement made, and I was appalled. Now, what you're saying is for 1 month. So should we as parents not be concerned about it? Should we as citizens not be concerned about it? Are we going to turn a blind eye, or are we going to do something about it?
So I think one thing that can be done, I mean what's written in the literature also, that you can provide services at the police station, because there is no accountability on these violations, because the victims are afraid to come and report, because the environment in the police stations are such that they can't talk to anybody about these things. So if you can have female officers or
Is the last resort if there has been a violent attack or something, then that's a different matter.
Exactly. So
but a lot of this is not that. So I think more psychological support services and other physical support is.
But I feel like that is not prevention though. That is taking remedial
prevention is sex education.
Prevention.
So we have co-ed schools, right? As Honorable Hakim said, we have big schools. A lot of things happen there when children come of age. 80-90% of that is never reported. When a girl gets pregnant, it's perhaps reported.
So what do we do? Let us not go into the morality of all of this. It's not our business here. But our business is if the law is broken and then, it's abuse, and then there are...
That also is a need, but they doesn't work properly. But they're supposed to have a women's desk at every police station. All that is supposed to be there. Yes, I know. That's why I say it doesn't work. It actually works the other way.
To come up with numbers, can we check how much we can allocate, or like the number of schools that we can provide with proper psychologists or counselors?
No, there is nothing like that. It's just that, this can't be without, I wish we had these guys also, the policy lab guys. Perhaps next time we can, the UNDP has that policy lab, no? That, etc., where you can actually check something out like this. So we are trying to get some new policy introduced, and if we can do it in a particular district or a particular area, then we can run it as a pilot and then see what impact it has at the end of the year, and then depending on that we can introduce it as a policy and allocate finances for it for the coming year. So that's how I would want to go about this. Could we think about writing up something on that? And perhaps, so it will be not a sort of a government policy as such, but testing out something like this, the best possible way of doing it. Maybe we could try out different ways of dealing with it, and then based on the response we get, and perhaps we could request UNDP's policy lab to help us design that study and run it. So what we need to allocate money is only for that this year. We can't address everything together, but at least let's try to do that. So can we use that as a second point?
Just to add to the discussion, there is I think there is already a system in place where child protection governance. We have various institutions and people put in place in divisional secretariats. There are, I think, 2 child protection officers and child rights promotion officers. So these officers are meant to be work on these type of issues, which is not utilized in a way that it's supposed to be. Since I work with Save the Children, I know this governance system is there, but that is very weak. So we might be able to look into how to improve this child protection governance system, which is already there, without putting further efforts on resources, bursting resources. That's one. And I take this opportunity to put another one, which I reviewed through the proposed budget, where there are lots of institutions and departments and centers are propose in this budget, which is, I think it's...
let's not go there for the moment. Let's hold that for the moment. But I appreciate your first point. And that is in the study design. You see, and if you're going to run this thing through the lab, which is what it is supposed to do, then let's look at what is out there. And then let's look at, a proper assessment and evidence. So we have some evidence-based policy making on this. And for these reasons, we should do it. So let's stop it at that and let's go to the next real point. Okay, and I'll come to that, which is a more general point. Anything from TISL's report that we can sort of work on with some numbers? Just one moment, please. Are you on the second point? New point?
Tax administration point, the TISL's report.
Okay, fine.
Just a few specific suggestions for consideration. One is to conduct a tax gap analysis for VAT and income taxes using a standard methodology. We haven't done that. And if we do it periodically, we'll be able to see the shortfall or, just rectify next time around. And the IMF has a good methodology that we can use to do this gap analysis. It's not very expensive. And since the IRD already has a substantive reform package that the IMF, USAID, UNDP, and I think it's the World Bank and ADB. All of us are supporting this. We can do this as part of it, but I didn't see it as a specific suggestion in the tax administration related reforms. Second is there was a point made by the colleague from TI on tax expenditures, these tax exemptions, which we call tax expenditures, right? We haven't really reviewed our tax expenditures. Sri Lanka hasn't done that. So, and it's overdue. This is also something I think we might be able to see the cost benefit. I'm not saying, I'm not aligning with the argument that we should do away with exemptions. I think we have to rationalize them, but not do away. I don't agree on that. But at least a review is needed. Third point is on improving the capacities of the IRD to conduct risk-based audits and tax crime investigations. They currently don't have the capacity, they don't have the staff, they don't have the skills. In terms of dollars, dollar amount, I can't put a finger on it, but it may be like a $200,000 per year type expense. That is quite important for the tax administration, I think. And lastly, this is more of a medium-term thing we can think about. Automation of transfer of third-party data for risk-based analysis of taxpayers. This also has been proposed by the IMF as part of the reform package.
I didn't get it.
So looking at third-party data, it could be banks, it could be other places where we use.
But once the revenue authority is established, will that address part of that?
We have to build it into it.
They talk about data sharing. No?
Yes.
Okay. So from our committee, what we can sort of think about is, okay, data sharing matter is really not within the purview of this committee. I think perhaps Ways and Means Committee perhaps might be the best to take up that matter because it's a revenue raising thing. Your third one about sort of tax crimes and capacity building, that really goes to the core of tax administration, the weakness in tax administration and corruption. I don't know how the members feel about us sort of, getting into that space. The second one that you referred to, or the first one, was a gap, right? And that is what I think is relevant to us. And you said no studies have been done. So perhaps we can spend a little bit more time and you can explain what you exactly meant. And the second one was about tax expenses. That one, the IMF has given them a timeline, so they'll have to stick to it. But I think this committee would be interested in the first one, because that is more of sort of following up with their own proposals and looking at why these gaps exist and how perhaps they can be closed. So if the members are interested, I can ask Dr. Gunasekar to explain a little bit more on what she really meant and see whether we could sort of take it up. Is there something that you want to add now, or?
Would you rather me send a note on this, or no?
I mean, what exactly did you mean when you said gaps in taxes? I mean, there can be so many different reasons, but what did you mean by it, and why did you bring it to the attention of this committee?
So when we increase VAT and all these, say, income taxes, right, we have a projection. But in reality, when we collect, we don't collect as much. So there is a gap, right? But if we want to really target now, say, next, we have to really identify who is actually falling through the cracks in the VAT system, right? And who is falling through the cracks in the income tax system and the reasons as to why. So that is what I meant by the tax gap analysis, so that we can target our measures a little bit better maybe in the next budget.
I mean, I don't think the Ministry of Finance has ever done sort of a Laffer curve analysis on tax revenue. This is more for the economists here, right? So, and when we ask them, they give us a vague sort of answer every time, So, I mean, I'm just thinking, right? Have they actually looked at elasticities? I mean, they say, look, we'll apply a massive tax on alcohol and tobacco. Does it really mean that, given the substitutes available and the benefit or the expected value of, not getting caught or getting caught, doing the wrong thing, smuggling, whether there is work that is available, right, that we can use to argue for better scientific taxing. I'm just putting it out to you all to respond. I mean, you have been talking about a lot of these things, but what is the scientific basis for us to say some of these things? Do we have the data? Do we have the analysis? Can we prove these things?
Are we concentrating on increasing direct taxes or indirect taxes?
Direct taxes.
Yeah. So, but that is not what is being done.
Yeah. So that is a mere political rhetoric. No, here we talk about. We always say, we must increase direct taxes, but the technical analysis behind it, right? The technical analysis behind it is, I think, what a committee like ours should be able to show. Right? These are the reasons, going beyond mere sort of words, and be able to show that these are the reasons why there is this much gap. Instead of showing there is a gap. Okay, so you take the gap. Why is this gap? Right? How much of it? People will easily say corruption. Catch the guys, they are not paying, That's the easy thing to say. But it could be that there are other reasons.
Is conveniently increasing taxes that can be collected without much effort. That is, if you may look at it, I'm not an economist, but isn't that what they have done?
Yeah,
now,
you're certainly right. But it doesn't take much effort to collect the pay tax. Yeah.
Pay tax. But
yes, you want to say something?
Yeah, I mean, it breaks down into about 4 categories, right? Like this tax gap. One is reporting errors, there is deficiencies in that. People don't know how to use the system. So, right? Then there is fraud. You also have declaration errors. You have a collection gap. That's where a lot of the administration issues come from, right? Bankruptcies and also fraudulent losses are part of all this. Then there's tax planning and base erosion, right, which is also part of the tax gap. And then illicit financial flows. So all these 4 things are part of this. So it's about estimating that. And I do think we have enough data. IRD has enough data to do this.
You're coming to a really good point. I think we should, TISL also should focus your attention, this base erosion, right? So this is something that because of the moving of multinational companies into different jurisdictions, how they can be headquartered in other countries where you can get lower taxes or can get tax benefits. Their revenue from operational jurisdictions are actually taxed in the headquartered jurisdiction. And that is why there is something called the common minimum tax, which is part of the OECD, and except for 6 countries globally, every country is part of that. Sri Lanka, Iran, a couple other, altogether 6 countries were not, right? So therefore, there has to be a study to understand, because there is a common belief, and I saw yesterday's FT, PICME CEO had made a desperate plea that saying that local companies like PICME will be mincemeat once the new taxes come in, because the multinational companies like Uber will not have to pay any tax, whereas local operations like PICME will go bankrupt. So I think as a committee, I think it is really important for us to study this matter, because there's a lot of political talk about it, right? No. So this is the thing. You know, what they say is, if you ask Facebook, right, do you pay taxes locally? Facebook will say yes. Because if you advertise on Facebook, you have to advertise through a local company that Facebook has appointed as agents. And then therefore, you will be taxed on those advertisements, right? Now, whether that is all their revenue, or whether Facebook is able to advertise through Facebook itself, is another matter. And then there is something called the digital services tax, right? Some countries have imposed these digital services tax, but those are nothing but agency functions of collecting like a VAT, right? Now that is not what other guys are talking about. The other guys are talking about taxing income of these companies, not merely playing the role of an agency function of collecting taxes from people and passing it along. So there is a lot of work I think we need to do in this, and I think as a Committee on Public Finance, it falls on our shoulders to really start looking into this at depth.
Now we are promoting card operations. We are trying to move away from cash transaction. But we are not benefited as a country. Now, MasterCard or Visa or whoever with whom we deal, they are not paying anything as taxes out of their profit, out of whatever they are making.
See, one main reason is Sri Lanka is one of 6 countries worldwide who said, no, we don't want. I mean, because correct me if I'm wrong, tax experts here, don't they have to pay 15% tax, multinationals, except for these 6 countries? If you are a minimum threshold?
Global minimum tax, but I think it's not yet coming to effect. But those who are signatories, once the rules are...
And then if that is the case, how and when can we become a signatory?
No, we refuse to become one.
Yeah.
We refuse to become one.
On what basis?
You have to ask P.B. Jayasundara.
Yeah, I mean, on one hand we say we must go with them, we must, and on the other hand, we refuse.
Yeah,
Where
so
do we stand?
So I mean,
even Uber, like now I know for a fact, I'm just telling you, there was a relation of mine, Sri Lankan, who stayed at Fortress. They were charged by the taxi guy from Koggala to Gaul 9,000 rupees, whereas Uber, when they checked, charges only 1,600. I mean
that is extortion.
That's extortion. So, but when if we try to promote Uber, then what happens to us? Is another issue.
No. So I think we can focus this discussion towards what Dr. Gunasekara mentioned about tax losses, and within tax losses or tax gap analysis, we can pick a few, and I think one of the most critical ones is the tax, perhaps the discrepancy or the inequity, what they speak of between local startups and others, and let us be objective about it, and see where it is possible for us to create efficiencies in the transaction, at the same time be able to maximize the revenue to the state. So it is not a maximizing question, it's really an optimizing question, because you can let the taxi guy, Honorable Virakuri, charge 9,000 rupees, that will go to Gaul local economy, but is it efficient, right?
It's very difficult to gauge which way is beneficial when we have two standards. We have double standards.
No. I mean, if somebody is charging from Fortress to Koggala 9,000 rupees, that's clearly too much, no?
Yeah.
Right? I mean, it may go...
Whereas these guys charge only 1,600. They're just, on the way they are just checked it.
Yeah. So can we focus on that? Can we, structure that question in an appropriate manner, and then we'll work on that. That is not for this debate, but that is for sort of a medium-term objective for this committee with your help. Fourth one, yes.
If I may come in on the second point that Dr. Gunasekara was referring to about tax exemptions, I think in the context of the conversation around corruption, it's really important for people to be able to see the rationale behind the granting of tax exemptions. So the fiscal transparency platform is something that the government needs to be allocating resources towards, and it's not something that would cost too much in that sense. It's just about making this information public, but also requiring that there should be a rationale that's made public, not just the recipients.
Well, I think you have to sort of break it down into two, right? One is now under the IMF's conditions, we'll have to have this ready, by 25, I think, no? 2025 or 2024?
Actually, the deadline for the fiscal transparency platform is already passed.
Haven't they sort of...
No, this was in the original country agreement, and it has not been conformed with.
So you mean that calculation of tax expenditures?
No, the requirement to have a fiscal transparency platform that publishes information about tax exemptions.
So just a platform?
Yes, platform and the information. No, it has not been done.
January 2024.
January 20.
Start estimating.
Start estimating and publishing the direct costs imposed by tax incentives by January 2024. So that's like few months away. So I think it's...
only to have the platform ready.
No, to start publishing.
Publishing the policy can be by the government.
Yeah.
Do we have to...
No, see the thing is...
set out policy as well in advance?
No, the thing is what Dr. Gunasekara was arguing as opposed to what was said here in the presentation, that we should sort of perhaps do away with tax exemptions. What she's saying is perhaps we should rationalize, right? So rationalize meaning 0 to 100, no. So if we are at a 0, then it is exemption, right? If it is at 100, that means you are getting the full benefit. And somewhere in the middle is some nuanced policy decision. So we don't have to get bogged down in that, as long as that is transparent. For instance, there was this classic case of a particular company, HCL, the BOI came here to our committee and wanted 17 years tax exemption. The only question I asked the chairman of the BOI was, what is the cost? What is the tax expenditure?
Whether there was a proposal in the first place.
Yeah, which became a big issue, and then he was, for whatever reason, removed, and I was also, for whatever reason, removed. But now I'm glad that that created so much, I think, discussion that it became a condition here. So what do we do with it? Is there something you propose that we do?
Yes, creation of the platform itself, the fiscal transparency platform itself.
But it is already there. What can we add new?
Yeah, what is there here is under the IMF's governance diagnostic. It doesn't necessarily form part of the government's commitments already.
We can't tell the government what to do. I mean, we can tell them, look, take this money away from here, perhaps put it here. But it's a policy decision of the government. This committee can't influence government's policy in that sense, like particularly governance policy. But we can suggest, reallocations or changes in funds. So can we do it? Can we do what we want to do, without saying, look, we are proposing government policy. This is what you perhaps can do, and then we get the same result at the end of the day. It's water on a duck's back now. Keep telling, keep telling, keep telling. If they don't do, what do we do? Why are you so desperate?
It's connecting to something else which was in the TISL presentation, but do you want to carry on that last point, or can I mention it?
If there is no movement on that, we can go to the next point.
Sure. This that point was really on the new Anti-Corruption Act, and needless to say, there are very ambitious objectives in the new Anti-Corruption Act. However, the resourcing for some of those ambitious goals I don't believe are supported. I know one of those particular areas is around the anti-corruption CIABOC requesting approximately 350 million rupees in establishing their electronic asset disclosure system, which should anyway be happening according to the within 6 months of the enactment of the Anti-Corruption Act. And so that may be, I think, one of the challenges here is that with the law being in place but no resources, there's really no attempt even to build public trust in the new powers given to CIABOC. And at least with that particular allocation, there's an opportunity to take something forward which will end up also engaging a large number of public servants amongst others through that 350 million allocation that CIABOC was requesting.
So has it been given, or has it been allocated 350 million?
No, it hasn't.
I mean, another matter I want to bring to your attention, because you all have been fighting so hard, is that we refused the request by the Ministry of Finance and the President's Office, on the proposed salary of the chairman and commissioners of the new anti-corruption board and that of the director general. Because what they told us is, unlike other independent commissions, these commissioners couldn't have another job or no other source of income. And the salary was 500,000 rupees. So DG salary was 400,000, but DG could have had, could be seconded from somewhere else, and if that person was getting a higher salary, that salary he or she would continue to get. But our objection was that 500,000 rupees for who we think has to be a superhero to fight corruption was not really in line with what we were expecting the CIABOC chief to be sort of paid. So, with the concurrence of my committee, I refused to approve it. So, we sent it back to the Ministry of Finance and to the President. But the argument that they made was that this is in line with the judges in the appeals court. And therefore, those people also did not have any secondary income. So why are you telling us that this person has to be special? I want to put it to TISL because you have been sort of the most vocal about this to seek your sort of views on this and perhaps some advice as how to proceed.
If I may come in. So as they very rightly said, it requires a full-time engagement, and the requirements under the law is that you should have 20 years of experience but be under the age of 62 years, which means you don't have the benefit of a long career behind you. And if you want to ensure diversity and young people, relatively young people being in these roles, if you don't pay them adequately, you immediately shut out a group of people from even considering this. So the criteria in the law are already quite restrictive. So when you want to find people who have the relevant expertise, it's hard enough. Then you say 20 years experience and under 62, you're further restricting the number of people.
15 years or that is for the post of
DG, 20 for the commissioners. Yes, exactly. So then if you you're also requiring them to leave a full-time job or not be able to have any other job or income.
Shut out completely.
I mean, in this context, your professional future and your future in this country in itself might be shut out if you do a good job on the bribery commission. So if that's the case, you're already putting in all these restrictions and then refuse to pay them. You're losing diversity as well, and you're losing the pool of people from whom you can choose. So I think the
yeah, but then
point is clear,
that is still the problem. What is the solution?
And going by the previous experience now, there was a DG who came on secondment to bribery commission. She missed the opportunity to become even the Solicitor General due to the fact that she did a straightforward service. I mean, there is a living example.
I know.
So you have to. I know we pushed for it. I don't know. We didn't ask for much. What we asked for was to place that person in the position of a salary of the President Court of Appeal. At least place on that. Even there, the tax comes to about 150,000. So reasonable amount of the salary will be deducted.
And if you
sorry, go ahead.
If you consider best practice across the world, there is also this sense that you should place anti-corruption agency members or equivalent bodies above a place of being able to be touched by corruption themselves, above being bribed themselves, so to make them comfortable enough. That doesn't necessarily prevent them from being corrupted, but there is that debate happening and that recommendation made also.
Honorable Hakim, I mean, how should we address this? I mean, are we just going to say, well, this is the law and this is the government regulation, so let this person be paid 500,000 and sort of carry on? And do you think the fight thus far to get this new act passed, would ultimately be even worth it?
Casting aspersions on Attorney General's department people, but when they draft these laws, they look at job opportunities so that they can get in there. You see, that is how this is drafted. So,
but in this case, it's the reverse incentive.
Yeah, AG's department, the officers on that level draw higher salary than the DG bribery. Because apart from their salary.
No, they want to get in there after retirement.
This one they can't. They see, unless 60, yeah, they retire by that. Like a person who retires at 60 is at least a senior additional solicitor general who would want to be served there for 2 years. DG's post is more important than the other positions. Like others are not full time. DG is a full time job, but no one from the Attorney General's department will come there.
400,000 rupees.
Even a junior state counsel gets about 350,000. Huh? Starting salary is 350,000. No?
So I mean, there's something really wrong with this.
When the starting salary there is 350,000, who will join after 15 years for a salary of 400,000? Take home is not that.
I mean, given the critical issue of corruption in this country, this is critically important that we make the necessary allocations for this. Because if we are expecting to rid the country of a state capture situation, where high profile corruption cases have to be impartially and, strongly prosecuted in a court system that is plagued by laws, delays, with all of this, these forces against you, we really, really need to figure out how to incentivize this.
Yeah, so we have a roadblock really, and I mean, what we could do is to refuse to agree, which is what we did, right? So that means it has gone back to the drawing board, right? Because if we agreed, it would have been law this week. So we sort of put up a strong fight and said we won't. The entire committee finally agreed. I think so too. I think so too. I mean, yeah, we are also limited by certain sort of
huge opposition when arriving at that decision. We got slanted also.
Yeah, you got slanted in a big way.
Yeah.
But
for fighting.
Yeah, but at the end of the day, as chairman, I must say that I was able to bring everyone to the same page, and it was a unanimous decision at the end of the day, right? So now it is back to their court. So I don't know, civil society can put more pressure, talk about it, maybe, speak to people in government.
Mm-hmm.
Yes.
But just on the on this point around the 350 million rupee request from Siabok to ensure that their statutory obligation to set up the electronic asset disclosure system, to ensure that that is supported. I mean, that is a big step in the national integrity system for what may not be, in the grand scheme of the budget, a huge sum of money, but that is going to probably be the only bit of progress on the new Anti-Corruption Act.
We are willing to take it up. What we can do is sort of expand on this, give a specific brief to all our members on this 350 million rupee requirement for the platform, what it entails and why it is important. And also it is necessary by 1st of January 2024 if we are to meet these governance conditions set by the IMF. Less than, so $1 million, right? So look at it. So we are running out of time. I want to finish in the next few minutes. The last point, we thought maybe 4 or 5 points. We have four things without this.
Something we could do from our side is to share, so we had some health specific recommendations. So I'm willing to share some of the analysis and the figures we have, especially for the mental health and the elderly care with you, so that maybe we can take it up in through those channels.
think this is not a recommendation for this one. I think if we can even work within these three, that will be great, Chairman. Just one request is, like, as you mentioned, like, we have this meeting today, which is quite late as well already. So even at least for next year, if we can have biannual meeting with this forum, with this sort of a diverse group, then we can also give more assistance in terms of whatever that we've been discussing for the next budget as well.
Okay. I'll reply you on that. You had a point that I said I will pick up later. This is the last point then.
Yeah, I just wanted to bring, when we were talking about where to bring money from the budget, there are several institutions and departments proposed to bring up through this budget. I think that's already we have enough institution and governance system where it's already failed in practice. So it's if we can look at that to strengthen existing and cut down those budget from proposed budget and utilize the proposal that we've been saying. And another point I want also to raise, the recent stats says 31% of people are in the poverty line and 70% of people in food insecurity. So this budget doesn't look at in the food security side. So if there's something that we could propose, like basic things, home garden system where people could grow their own food products at home and do some kind of resilient for food security. So those are the two things that I want to bring in.
That's a more general point. I don't, personal view is the government should stay away from distributing at a, like earlier. Yeah, I mean, that they spent billions in this home gardening project, remember, Divinaguma? I think it was an utter failure, and I think you should let individuals decide, you know, and I think it was totally corrupt also. Before we close, yes, your point.
No, I want to go back a bit where we started off from. The presentation that was made, first presentation, touched on the issue of population that is aging very fast in Sri Lanka, and the supportive services that should be there for the elderly. Part of it was the transport, public transport, but also, you know, provincial council, the budget allocations should focus on providing quality elder care services, which doesn't mean the elder care homes only, but whatever the elder care, because right now it's the private sector that has moved in, so the public sector has not moved in. Those who are earning, you know, less than whatever amount of money cannot get higher private sector carers for the elderly. So the public sector must have allocations that would give quality care for the elderly. Now the public health midwives go and look at women who are pregnant and who are post-delivery. There is nothing, no services actually that are in place that look at give services for the numbers of the elderly. That's going to be 30%, 20% of our population in another 10 years or so. That means that we have Mahalu Madam, you know, that's what we call it. We don't even have the quality of care. It can be day care, but the allocations can be made with provincial and local councils. Similarly for child care, we consistently go on about women not being in the labor force, but there is the issue of unpaid care work that is not given any kind of recognition, and we need to be able to give create that environment where women will come out or take up paid work. And that's not going to happen just with a few sprinkling of childcare centers here and there. The World Bank had a program which ended, I think, about 2 years ago, which was assessment of the number of childcare, Montessori's, etc. I think there needs to be allocations from this budget that can go into providing. The Colombo municipality has childcare because the Colombo municipality is the richest municipality in the country. But the quality, I think, leaves much to be desired. no train. Most people are not trained, the people who are there, who are looking after children. So these are also, aspects that we need to look at if we are looking at development, this path that we are going on. We have to first of all recognize that the elderly are going to be a huge, significant number of the population. And we don't see provisions coming out of either the healthcare or this social services. I mean, social services has some programs, but really not enough to deal with the kind of services. There was an allocation last year to bring in elderly and persons with disability so that they can contribute. So can we look at just see how they can live their lives in old age? Why do we have to pull out the elderly to say now if they wish to, yes, but care, health care, access to health care. So those are my points. Thank you.
No, I appreciate your point. My father is 90 years old and I know what you really mean, right? And how much it takes to look after a person that old. And, because I have a sister who has more time than me and who is medically qualified, that's helpful. But I mean, I understand. I just mentioned a personal story because I know what you mean, right? But
because today the structures of the family unit, what we call the family unit, is changing very fast. We are not an extended family system. We are more and more nuclear families we are going into, and all our development policies are geared to that. So where does that mean?
I mean, this is a vast topic. I mean, we don't have the time now to go into. So where does it leave
the care of elderly?
Yeah, so I mean, all what I wanted to say is I personally, appreciate what you're saying, but we can't, so this is not our really mandate to sort of come up with elderly care policy in this committee, right? However, if, we can, point out maybe some specific thing that we can propose. You see the distinction I'm making here, right? We are not a policy body. We don't make policy, right? Our job is to look at the public finance. So there is a policy, it costs so much, what is the benefit, can we do it better? So if we can pick out what the government has proposed and then perhaps say, look, if you do this or that, the impact of that would be X or Y, something like that. And I want to show some numbers behind it. So I don't know enough about the whole subject to tell you how to do this. But perhaps this is something we can take on a medium-term basis. Not for this budget, but at least for the next budget, right? So I'll stop at that. If there are no other interventions, 2 hours is up. Yeah.
Quick response to this. So what we have is, we have some numbers on the number of care workers that will be required for elderly care, and we can, put some like rupee values behind that as well. And there is also a pilot that is being conducted at the community level, very similar to the PHMs, but then targeting the elderly. So this has been done in Kotte and a few other areas in Colombo. So we do have a few, I think there is a value behind that. So if we can, I think we can also then, pull that out, and that's what I said. So I will, share some of that. So there are at least some specific things we can do, I think, hopefully targeting this budget, but at least, going forward on this.
Okay, ladies and gentlemen, thank you. We've exhausted our allocated time. So what we have done is we picked up 5 things, 3 of which hopefully we'll be able to debate during this budget, the committee stage. The first one is on the vouchers for period poverty. So the decision here was that we calculate the number and the mechanism through which we could make sure that girls in school who need the support actually end up getting that support, right? That's the first one. The second one was on this whole issue of children and pregnancies and and I think what we said was we'll look at different models, right? There were some that was already happening, and isn't it where we said let's look at a medium-term solution where we can perhaps look at a pilot, isn't it? Yeah, so, and we requested UNDP also to see whether they can work on this with Citra Labs and, come up with a plan that is for a more longer term, medium term one. Then the third one was on the tax gap, which I think is fairly critical. The faster we sort of understand it, better it would be, and particularly in terms of e-commerce and the gig economy and the base erosion that you talked about. Look at how other countries have adopted, what the benefits are. And perhaps we can look at what's happening in places like Tamil Nadu and Andhra and Telangana, because there is a lot of both global and local IT-enabled and IT-related services, right? Every other startup is IT-based. And you see the ecosystem working really well, both local and global. So perhaps there are lessons that we can learn from south of India, and then maybe we can incorporate those, but that's also a medium-term one. Then the other thing is on Seabok and the 350 million rupee thing, then that's again for this budget, for this debate, right? How we can ensure that, push them to make sure that the money is allocated, and we make a strong case based on the governance conditions and so on. And the last point is on elderly care, which I do appreciate, but it will have to be sort of a medium-term thing that we can target the next budget, right? So there are two things for the next budget, that is the elder care and the child abuse one. And the other three, two, period poverty and Seabok matter for this debate, and the tax gap soon, I don't know, as soon as possible. Did I capture everything? If there's nothing else, once again we want to thank you, and I think this was a rich discussion. I hope next time more.
Yes. Can I also request, Sankita, that you send your salient points on the book in Sinhala so we can give to the all the parliamentarians, I think, 225 things.
You want to say anything more, Mr. Vignaraja? Right. Okay. So then this meeting is adjourned. We appreciate your support. Thank you.